I'm Chelsea and I'm going to be your nurse today. Today we're going to be doing a GI assessment, and before we start off I just have one quick question to ask you. Do you have any GI problems at all?
No.
No? Have you had any issues within the past few weeks?
No, I do not.
Perfect. Alright, well then to start off I'm going to have you lay back and you can place your head up here. And the first thing I'm going to do is just inspect his abdomen area, and I'm looking for symmetry between both sides, looking for any visible masses or wounds, and I'm not seeing any of those. Next, I'm going to move on to listening. I'm going to start off using the diaphragm of my stethoscope to listen to his bowel sounds, and I'll be starting in the right lower quadrant. Perfect. And I heard active bowel sounds in all 4 quadrants. The next thing I'm going to do is I'm going to listen to his vascular sounds, and now I'm switching to the bell of my stethoscope. I'm starting off with the aortic artery, which is right at the xiphoid process. Perfect. And I'm moving on to the renal artery. And now the iliac arteries. All right, and I heard normal sounds in all of those. I was listening for a bruit or anything abnormal like that, and I didn't hear any of those. Next, I'm going to move on to palpation. I am going to start in the right lower quadrant with light palpation, and then just move up throughout the other quadrants. And what I'm looking for is any masses, lumps, pain, or tenderness. And are you feeling any tenderness at all? Perfect. And now I'm going to move on to deep palpation. I'll be pressing down about 4 to 5 centimeters. And I'm once again looking for any masses, anything that feels enlarged or abnormal. Are you feeling any pain with this? Perfect. All right. And next, I'm going to move on to palpating the liver. I'm going to move over to this side. I'm going to have you take a deep breath in for me. And exhale. All right, and I'm feeling the border of the liver about here in its correct anatomical position, so that's looking good. Doesn't feel enlarged. And next, I'm going to move on to palpating the spleen. I'm going to start in the right lower quadrant, and I'm just going to move up in a diagonal motion, looking for any pain or tenderness, or if it feels enlarged at all. I'm not seeing any of those. Next, I'm going to move on to percussion. I'm going to percuss the spleen at the midclavicular line, the last intercostal space. And I'm hearing tympany, which is the normal sound for that spot. All right, and the last thing I'm going to do, if you can sit up for me and turn around, I'm going to percuss the kidneys. I'm going to start off on this side looking for the costovertebral angle. Put my non-dominant hand in the thud. Do you feel any pain with that? Perfect. And moving on to the next side, costovertebral angle. Any pain?
No.
Awesome. And that is a normal finding. And that concludes our assessment. Thank you.